every time I meet someone new and begin to share my testimony of how I am a woman or a heart disease survivor, a women heart champion. I received my heart transplant at 15, and they just cannot believe that I'm a heart transplant recipient. I'm not certain exactly what the perception is of one who's had heart disease. If they're always weak, if they're on a cane, if they're just can do anything. I have no idea what the perception is, but obviously it's not me, because they always say, "You look so great. I can't believe it's you. You're only 24. How did that happen to you?" Well, I want to share that it can happen to anybody. The face of heart disease can look like mine, and can be African American 24. It can be Native American 78. I'm at a Women Heart Symposium, Science and Leadership Symposium presently, where the age range is 23 to 74. 65 women from 30 states, various cultural backgrounds. It could happen to anyone.
I have atrial fibrillation, chronic bradycardia, and supraventricular tachycardia. So if I was to try to explain to somebody, it would be like you were driving a sports car down a highway going 150 miles an hour, and then all of a sudden it would back off and go to 30, and then you would be driving 80, and then it would go to 50, and your heart just does whatever it wants at any time, and you don't know when it's coming, and there's no way to prevent it, and there's really no cure. There's a lot of band-aids that they can put on it to try to help with the symptoms, but as of right now, there's not a lot that they can do for me. There aren't any support groups. Even though I lived in a large area in New York State, there are no support groups, especially not for women in my area. And the first day, there was a lot of tears because a lot of women have never told their stories. A lot of us have never had friends or made friends with people who have had heart disease because people don't want to talk about it. And to come here and have 60 women all come together and pretty much give you one big hug all at once, it heals you. Your doctor can help heal your heart, but this kind of heals your soul.
What is important to me, and what I think a lot of women need to really, really listen to, understand, and do, is that we are by nature caregivers. We are so used to taking care of other people that we don't take care of ourselves. And I'm a perfect example of that. I was the walking dead. I had to take care of my clients. I had to take care of my friends. I had to take care and do when it's amazing I didn't drop dead. And I think what we have to understand is that if we don't take care of ourselves, then we can't take care of other people. And then we are actually letting ourselves down and everybody else down. So when we do start feeling sick, we have to take it serious. We can't say, "Oh, it's nothing, I'll be better." "Oh, I have to be strong." "Oh, I'm a woman, I'll look like a wimp if I stay home. I work with all men, so I have to be stronger than them." But that's the wrong attitude. We have to pay attention to our bodies, and we have to pay attention to that little voice inside of our head that says, something is wrong. It's not going to go away. It's the big elephant in the side of the room. So actually, in my case, was the big elephant on my chest. And I'm thinking my problem was my asthma, but it was congestive heart failure and cardiomyopathy from a virus. I got sick and it almost killed me, and that's happened to a lot of women. So I think we have to really listen to ourselves, and if we have a friend that's sick, we have to encourage our friends to go seek medical treatment. The day I finally sought medical treatment, my best friend showed up at my office and said, "I am not leaving until you find her and we take her to the hospital because she is going to die."
I'm kind of a mystery because I had a heart attack, which resulted in cardiac arrest, which resulted in not being able to find any reason for it. Really, there was no reason. I have none of the risk factors for heart attack, yet I had one, and so what they told me was they think it was a spasm that created a clot that then was blown out by the thrombolytic medicine. And other than that, that's the most they can tell me. Really, really interested in building some kind of program that teaches young women to take care of their hearts now, to take seriously that what you do now can make a difference in what happens to you later. If you have a so many of the stories that people have told, they were young women that didn't know they had anything wrong until they were in their 20s, in their 30s, and then suddenly something is discovered. But certainly how you take care of your body prior to that will make a difference in how you recover. And I think it's certainly the fact that I was fairly fit, fairly active, all those things made a difference in the fact that I have had a very excellent recovery, and I'm lucky, and I'm on little medication, and I don't have any restrictions, and my outlook is that I probably won't ever have another episode.
When I go back, I not only hope to educate women, I want to educate young girls. I'm still an educator. I'm still a teacher. Young girls I see every day that are doing things I know is going to lead to heart disease, if not sudden death. I want to put a stop to it one way or another. I want to educate them. And some of them will go back and even educate their parents, their moms, because I see a lot of parents that come to PTA meetings and conferences, they need help. So I want to help those that I figure cannot really, I'm not saying they can't help themselves, but they won't. Maybe they'll listen to me.